Calling all Swifties and champions of change, Like a Girl Media is rolling out the red carpet for you with our Thrive Like a Girl contest. We're all about celebrating powerful women leaders who inspire us to dream big and push boundaries. And who embodies that spirit more than Taylor Swift herself? Here's your chance to see her live in concert. We're giving away 2 tickets to Taylor Swift's show in London on Saturday, June 22nd. Imagine being part of the magic, all thanks to Like a Girl Media. Entering is easy. Subscribe, share, and show us which episodes inspired you the most. Visit our website or check our social media for all the details. Don't just dream it, be it. Thrive like a girl and make this summer unforgettable. Contest opens globally, void where prohibited, must be 18 or older to enter, no purchase necessary. Subscribe and share with hashtag Thrive Like a Girl and tag us at likeagirl_media for entry. Unlimited entries means unlimited chances. Winner chosen at random after contest closes May 20th, 2024. Will be notified via DM. Make sure your profiles are not private. Check full rules on our site. This is your shot to see Taylor Swift live. Don't miss it.
Welcome to the High Tea with Grace podcast, where we spill the tea on HIT. Today, I'm honored to welcome Dr. Carrie Nelson, Chief Medical Officer of KeyCare. Dr. Nelson, thanks for joining us.
Thank you, Grace. Happy to be with you.
So let's start by having you tell us about the career path that brought you to your current role at KeyCare.
Well, you bet. Yes, happy to. I'm a family physician by training, and I think like a lot of physician leaders, we didn't envision going into any leadership roles, just thought I would come out of medical school and practice medicine for the rest of my days. And I did that for quite a number of years. I was in full-time practice for about 13 years in my own practice that was with 2 other women in the community where I live. Yeah, we had our own practice. There was a day when doctors actually had their very own practice. But I wound up getting captivated by some of the information that was coming out from the Institute of Medicine in the late 90s, which was around the 2 Eras Human Report and the Crossing the Quality Chasm. And it just resonated for me based on everything I'd seen, that we had a huge opportunity to improve the quality and the safety of the care that we were delivering. So I started stepping into some leadership roles, primarily just by raising my hand for projects and whatnot. And that led me down a path to where I took on successive leadership roles, leading quality, safety, and population health. And did that for a good long time. And I had a stint as a residency program director for a while as well, but also still deeply involved in clinical care and leading on those topics. But ultimately, so most of my career was really within the traditional healthcare system, starting quality and safety programs. And at my most recent role in the healthcare system was at Advocate Aurora Health here in the Midwest. I live in Chicago. And so it's a 27 hospital system. I came in through the population health arm when we first signed our first value-based contract. And they had a clinically integrated network that was really well positioned to be able to see where we could take it to the next level on improving value and quality and cost. And so I then started that work and added quality and safety to my responsibilities while I was there, and was there for about 11 years, overseeing those areas.
Wow.
We went through the pandemic then, and I thought, oh my goodness, all these years of leading healthcare transformation, and I'm seeing us transform at a rapid clip that has never happened before. And I got excited about the possibilities of learning from that experience, and then being able to translate that into a more accelerated pace of change. Unfortunately, that didn't happen, as it didn't happen for many other health systems. It just is, it's a hard business we're in. And I came to the conclusion that healthcare systems were going to need really strong partners from the outside if we were really going to transform care.
Mm-hmm.
So that led me to working in healthcare IT, digital care models, and I joined KeyCare here just last fall as their Chief Medical Officer.
That's often awesome. So give me a little bit of information about KeyCare and like what KeyCare is, so people have an idea.
Sure. So KeyCare is a young a young company, and it was founded by a physician, Lyle Berkowitz, who I've known for a number of years, but had not really been in touch with until more recently. And he's an internist out of Northwestern. He's got a lot of experience in improving healthcare models, innovation, IT innovation, and he was successful in working with Epic to get them to sell first to their only forever startup and the only virtual health care provider. They sold us an instance of Epic. So KeyCare has its own instance of Epic. We have providers, predominantly physicians, that are seeing urgent care and virtual primary care on the Epic instance that we have, but on the behalf of health systems. And we have 16 health systems contracted today and are delivering, really the wraparound that's needed, because we know there's a tremendous primary care shortage. It's only getting worse, and really helping them to serve their communities more fully, 24/7, 365 in 50 states.
Wow. So interesting, because, telehealth used to be from the outside in, right? They would refer you to a telehealth provider. So to be from the inside out is a very unique model and is very new. I don't think people realize that, telehealth has historically just been like, oh, you need telehealth, go to that company that does telehealth. But so health systems are now able to, then you're saying, kind of have it be in-house in a sense through a partner.
Exactly.
So, as someone deeply involved in healthcare transformation, what do you see as the most significant benefits of telehealth, generally speaking, particularly in the terms of, patient safety and the quality of care, knowing that's such a passion of yours?
Mm-hmm. Absolutely. Yeah, I wouldn't be doing this work if I didn't believe firmly in the ability to deliver high quality, safe care through this modality. And there's lots of evidence that's been coming out, and people are studying this. And we had the boon of the pandemic that provided a huge volume of experience that we can now look back on and say, what did we learn? What did we see there around safety and quality? And so I'll quote a couple of different articles. JAMA has had a number of publications on this topic, in which Mayo Clinic studied about 2,000 patients, and this was published in September of 22, and they looked at what they call diagnostic concordance. And so was the diagnosis made over telehealth concordant to the diagnosis that was for the same patient within 90 days in the in-person, brick and mortar setting? And they found it was highly correlated. So, people are concerned about diagnostic accuracy as one component of the quality and safety. And I can first say diagnostic accuracy is a problem everywhere in healthcare. I know that from my years of leading on patient safety. But truly, a lot of concordance. And so it just goes to show that so much of what we do in healthcare, you can get a decent exam over telemedicine. You can take a good history and be completely focused on that person, right? So in my own office for the many years, I practiced for at least 25 years overall. I'd have a knock on the door, the ER's on the phone, or, I'm running late and I'm getting distracted. I'm getting, approached by the nurse or the MA about a patient phone call. In a telehealth environment, you're completely focused on that person. And so that's one advantage, right? Another study I'll quote is on another JAMA article that looked at whether or not people with telehealth, in addition to the brick and mortar care versus those that just had their care in brick and mortar, had any differences in the quality. And they found that those that had telehealth coupled with brick and mortar care had higher rates of medication adherence, higher rates of screening, higher rates of the appropriate labs that might need to be done for their chronic condition. So it's remarkable. It's not something that can live out in isolation and achieve those results. It really does need to be, an integrated part of the care model to enable, that kind of an impact. And
that's interesting of seeing virtual care that way. It's a sweetener, it's like, it's meant to complement, like you said, not necessarily replace. And, and
100%.
A lot of the criticism, it's subpar compared to in person because there's so much you can't see in person. But when I think of every virtual care visit I've had, they hit the nail on the head, and anyone that says that pretty much would say they hit the nail on the head. And if they didn't, you do have the ER to go to, right? And so that is something interesting that I think about all the time. Like, how I just wonder, are there situations where they're not getting that quality? And what is that? Because I'm not hearing many of those stories. Most of my friends are just saying, oh, it was an ear infection. I'm just so glad I didn't have to take them in for them. It was, no matter what, it has. If it looks like it, sounds like it, probably isn't, right? So I'd love to hear your voice and your thoughts on the recently announced Joint Commission accreditation. What is that related to patient safety and quality, et cetera, and how will it impact this virtual care space, as it relates to that?
Yeah, I'm just getting to look at those parameters and, preview the information that they're putting out there. So I don't have a lot of depth on it just yet. It was announced, I think, last week, and I finally, they have something on their website where I can download the preliminary information around it. But let me just say that I'm a firm believer in that external validation of the quality of the work, right? I think we all need somebody to say, here's some standards we want you to adhere to, and then see how we measure up to those standards. So URAC has had an accreditation for some time, and NCQA is also developing an accreditation for telehealth. So there's a trend in recognizing that this is a permanent part of our healthcare system. And despite, some of the chatter out there and the wake of, Optum closing down their telehealth and Walmart doing something similar, some challenges we've seen with some of, the competitors that we have in our environment. I think there's still a strong belief that we've just scratched the surface of what's possible here. So we better start really understanding how to set it up in a way that is, evidence-based, that adheres to a standard, and that, we can start to measure ourselves along those lines.
Yeah, it does seem that an accreditation process would kind of set the tone for the whole industry, so that these quality safety complaints or whatever else that's happening outside of, with around town would be lessened likely. And the quality of care and the quality of output is just better, overall. It does seem that way. You're a population health guru, right? You've worked in the population health space, value-based care space, et cetera. I'd love for you to talk about telehealth as value-based care, particularly how, using telehealth simply just increases access to care, right? For underserved populations and more. And how do you feel that virtual care models can address some of these healthcare disparities and improve overall population health, given your experience in this space? Would love to hear your insight on this. And I'm sure everyone's waiting on bated breath to hear it.
Oh, you're very kind, Grace. So, the literature goes back way back. Barbara Starfield, in particular, was a researcher that showed the incredible value that primary care brings to a community, and that where primary care is strong and invested in a given community, you see better outcomes and lower costs and better quality of life. So the fact that we're seeing, the challenges of adequate primary care in our communities is, it worries me as to what the future of being able to achieve those outcomes are, with population health goals. And so, in fact, there was a Milbank publication recently that showed 100 million Americans are without a usual source of care. Yeah, it's really something. And it's rural, but it's not just rural, it's also inner city. It's everywhere. And more primary care docs are really not even staying in, the brick and mortar primary care setting. They're doing different things. And so if we're going to solve this problem, we need to make sure that access is easier. And so we have we have value-based care solutions. We have situations where we're working with health systems to do annual wellness visits. There's a lot more that we can do beyond that, including care transition visits. I think there's a lot of value that can be brought to the population health equation through the use of telemedicine resources. Interestingly, my daughter-in-law is a family doctor, and there's certain things that only can be seen in brick and mortar. And one of the things she said to me when I was talking to her about the work we do, she said, I would love to have somebody take all my annual wellness visits. She says, I just don't see the value of what I'm really doing in person in that setting. And there are people that are waiting to be seen. Another example I would provide, it relates to chronic condition care. So I know in my own practice, and we know from the literature, it takes a long time, much longer than it should, in terms of getting a person's blood pressure under control, from the time of diagnosis to actually getting it in control. The data shows it's like 2.5 years. It's just insane. And I can think back to my practice, and I would see a patient, I'd make a medication dosage change. I'd say, I'd want to see you back here in, say, 2 to 3 weeks or maybe a month. And they'd go to the desk and it'd be 3 months before they could get in. So that's one of the factors, And so we can create sort of a focused factory around this, where we're titrating medicines, we're getting more patient engagement, we're getting correct measurement of blood pressure at home, where it's actually more accurate, and we can really deliver on getting to those health outcomes that have really eluded us for too long.
So interesting and such a thoughtful response. I appreciate that. Can you speak to the role of data and analytics also in optimizing telehealth services? They have to meet these rigorous standards of care, and contribute to value-based care objectives. So, tell me a little bit about that role of data and analytics in this space now.
Gosh, it's so important. I'm really glad you're raising it. I think it's been underappreciated in a lot of the telehealth models that we've seen through the standalone model that's out there. The one thing I'll say with our solution is we have Epic. And so Epic has a tremendous amount of analytics capacity. We have the data that we have is so rich, and it's interesting for a startup. A lot of times the data isn't quite there, but we are very heavy on data. We can understand, antibiotic stewardship. We can see the kinds of conditions that our providers are treating. We can identify conditions that would be an unusual telehealth condition, and then create follow-up programs to make sure that that person's okay and that they got the care they needed. We, just have a tremendous ability to slice and dice the data in ways that will truly demonstrate the kind of impact that we're having, and call out things that we need to be learning and improving upon. And that's just critical to healthcare in general.
So interesting. I think your background is just so fascinating, having that value-based care, healthcare delivery, value-based care, kind of, population health, and then now this technology element. What innovations, with that background in mind, what innovations do you foresee shaping the future of telehealth now in virtual care? We see all this news about Optum closing down its virtual care, and Walmart Health not doing it anymore. And folks are saying in the industry, is telehealth dead? Like, is telehealth dead? And what do you think? What do you think about all of this? What is the future of telehealth to you?
Yeah. Well, I think we're at a critical turning point, right? So I do believe the model of telehealth that lives in isolation, that can't be viewed by the regular source of care, the providers that are in the brick and mortar, that model is just not going to help us realize the potential that is really here. When all of the information lives in a silo and cannot be shared, that just isn't going to work. And so that aspect of telehealth, I do believe, is dying. I mean, the evidence is there in the news every day. We're at a turning point, though, to where we can now start it with a model that's more fully integrated with the brick and mortar. It needs to be hybrid, right? As you said early on in this conversation, it's a sweetener. It's not something that can replace all kinds of care. But how do we free up our precious primary care providers to provide the kind of care that's that can only be delivered in person, and then offload some of the care that can be best delivered over virtual models, and then be able to see, we've seen some data where we've got patients that in a given health system, they've had over 5 visits with us in the space of about 3 months. That needs to be delved into. Do they have a chronic condition that is not, under control? Do they have a recurrent problem that really needs to get them navigated back to their primary source of care? So that's work we're doing today to be able to augment the brick and mortar window to what's really going on with these folks in a way that can, get them redirected back to their primary care when it's really needed. People shouldn't need telehealth more than a couple times a year at the most. And if they're repeatedly using it, for an urgent care condition, you have to really wonder, is it an access problem? All of those things are questions that we can answer with the data that we have.
Interesting.
Mm-hmm.
It's my last kind of industry question before we dive into your personal life and doing some more personal questions about leadership and more is, what strategies do you feel the industry should be advocating for to maintain the highest standards of care? We're talking about the accreditation. What are some of the strategies that they need to be thinking about, to promote its widespread adoption while also keeping things super safe and super high quality? And what are those strategies that the industry should generally be keeping in mind?
I think there needs to be transparency of information, right? So when we work with health systems, I want to feel proud to share with them our quality outcomes. And if they're not okay, I want to have a conversation about that as well. If we have a patient safety incident, I want to, full disclosure has to include working with that health system to let them know that this kind of thing happened, and what we learned from it and what we're doing to prevent it from happening again. I mean, safety issues are everywhere in healthcare. There's no reason to think we won't have them in telemedicine. We'd be blind, right? And so, that full transparency is really essential. I do believe, as you mentioned, the accreditation. I do think we've got to make some adaptations, some of the NCQA measurement methodologies and how they define numerators and denominators and the requirements for certain measures. Sometimes that doesn't really lend itself to telehealth being supportive of achieving those measures. I also think we've got to make sure that we solve bandwidth problems that are in some of these communities. We've got to get to telehealth permanency. So those are the things that, are going to just open the door for more and more innovation. But I'd be foolish if I didn't say AI. AI is also going to be a game changer. More at-home testing, right? There's even pap smear testing that can be done at home.
Oh my goodness!
I know. How about that, right? It's not what you think, right? It's entirely different. But I can imagine us all having a kit in our home that enables us to look in an ear over a telehealth methodology, be able to do a strep test, be able to do a urine, be able to do some of the common things that we know would benefit from additional testing when people may be in a rural area and can't get to a site where that's available. But AI, we're looking at all of those possibilities, from the standpoint of just making the work more efficient for the physicians that we're working with, but also collecting blood pressure measurements and understanding, based on a person's voice, what is their mood? Are they really, more depressed than they're trying to portray to us? Those technologies are just going to be game changers increasingly, and opening the doors for what's possible.
So interesting. Thank you for sharing this. Very fascinating. I'm sure everybody's lots of comments. Feel free to write a question in the comment and we'll share it with Dr. Nelson. She would love to answer it for you. So, we really try to understand what drives women in healthcare IT, like amazing leaders like yourself that have held so many different types of leadership positions. What are things that you do in your career that help you work your best and make a difference and keep going despite obstacles coming your way?
Yeah, I learned early on, one of my first experiences in trying to lead a change initiative in my own practice with people that, I was friends with. I was shocked at the amount of resistance I got. And that was like the most pivotal learning experience for me as a leader, that first of all, expect resistance. It's not personal. It's human nature. And we just have to keep moving through it. Just keep moving through it. So it's persistence and patience, in all of those things, and then really hearing, what their concerns are, what their sources of resistance are, and then working to overcome them together. I think that's been said probably many, many times, but it's not to be underestimated as to how much fortitude it really takes to keep that going. So that would be like my number one thing. And then also I would just, I put a high value on relationships. And, Stephen Covey talks about the speed of trust and how much those relationships can help you move mountains if they're really on solid ground. So those would be a couple of things that are top of mind.
I love that. I love that. Do you have any advice for women looking to get in healthcare and health IT? Like, what could you tell your younger self getting into the industry that you kind of wish somebody had told you about the space?
Yeah, I think, it's probably overestimated how difficult it is to step into leadership roles. Honestly, it's about raising your hand and showing up. Most people don't do those two things. You raise your hand and you show up, and you don't be afraid to have a voice, and you'll start to get attention. People will appreciate that you're at least trying, even though you're still on your own learning curve. That is the thing that I remember the most, is being young. I was in my, probably in my early 30s when I first started stepping into, those kinds of forums, and being sort of surprised that it was welcome, more so than I would have anticipated. So that's a big one. And then look for your allies, look for your mentors. I don't think I've had a lot of women mentors, but I definitely have a lot of allies. And sometimes you just need to vent a little bit to some of those allies and then come back to the game. Other times it's, really about, helping you strategize, working through a given problem. So those would be the things that I think about.
Well, thank you for showing up. We appreciate that, because then we get to learn from you. So that's fantastic.
Thank you.
So to finish this conversation off, right, where can our listeners find you online?
Well, certainly LinkedIn, Carrie Nelson, MD. And you can go to our KeyCare website, keycare.com, and I believe it's .com. I should double check that.
I think it's keycare.org, actually, because I looked it up earlier.
Keycare.org. Thank you. I don't typically go to our own website. I hope you can edit that part out, right? That, right,
We're all good. We're all good.
Good.
That's
so and our Lyle Berkowitz, our CEO, is real active as well, and he's a voice to definitely follow on those platforms.
Yeah, Dr. Lyle's a longtime friend of mine, and he's the one that pointed me in your direction. He's like, you have to interview her. She's amazing. And I believe it. You have been amazing. So before I forget, did you happen to bring tea with you today?
I did bring tea. I'm so glad you
tell me about your mug. Yes.
So I don't know, this mug I've had for a long time, but I just love that it's so colorful, and it just kind of, it's funny how the receptacle that you're drinking something out of can really brighten up the whole experience.
It really does. It is colorful. It's like green and multicolored and happy.
And it's even got flowers on the inside.
Oh, I love it.
Keep it, because then I'll spill all over my my keyboard.
I know. The funny thing about having tea with me is that you end up talking the whole time, and I can drink my tea, but you can't drink the tea until afterwards. So that's great. What kind of tea are you drinking?
This is a ginger tea. I'm an herbal tea person. Yeah, I have my coffee first thing in the morning. I never miss that. But then later on, I'm all about, trying not to have the caffeine. A good night's sleep is a thing that is really another pointer for people that are on a leadership journey. And so, I try to keep the caffeine out of the later part of my day.
Oh, I love that. Well, that's too good. Thank you so much for joining us, Dr. Nelson. It was great having you here.
Thank you so much, Grace. It's been a real pleasure.
And thanks to you folks for joining us too. Check out the High Tea with Grace podcast interviews with Dr. Nelson today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.